Addison disease overview. Introduction. Addison disease, also known as adrenal insufficiency, is a condition that occurs when the adrenal glands do not produce enough hormones. This disease is named after the physician, Thomas Addison, who first described it in 1855. It is a rare disease that affects about 1 in 100,000 people. In this presentation, we will discuss the causes, symptoms, diagnosis, and treatment of Addison disease. Causes. Addison disease is caused by damage to the adrenal glands. The damage can be due to an autoimmune reaction, where the body's immune system attacks the adrenal glands, or it can be due to an infection, such as tuberculosis or a fungal infection. In some cases, Addison disease can also be caused by cancer that has spread to the adrenal glands. Symptoms. The symptoms of Addison disease can be vague and nonspecific, which can make it difficult to diagnose. The most common symptoms include fatigue, weakness, weight loss, and loss of appetite. Other symptoms may include nausea, vomiting, diarrhea, abdominal pain, salt cravings, and low blood pressure. In some cases, the disease can cause hyperpigmentation of the skin, especially in areas of the body exposed to the sun. Diagnosis. The diagnosis of Addison disease involves a combination of blood tests, imaging studies, and stimulation tests. Blood tests can measure the levels of cortisol and aldosterone, which are hormones produced by the adrenal glands. Imaging studies, such as CT scans or MRIs, can help identify any abnormalities in the adrenal glands. Stimulation tests can help determine if the adrenal glands are producing enough hormones. Treatment. The treatment of Addison disease involves replacing the hormones that the adrenal glands are not producing. This is usually done with oral corticosteroids, such as hydrocortisone or prednisone, and mineralocorticoids, such as fludrocortisone. The dosage and timing of these medications are usually adjusted based on the individual's hormone levels and symptoms. Patients with Addison disease may also need to take additional medications, such as salt tablets or potassium supplements, to help maintain their electrolyte balance. Complications. If left untreated, Addison disease can lead to life-threatening complications, such as an Addisonian crisis. This occurs when the body experiences a sudden drop in cortisol levels, which can lead to shock, coma, or even death. Patients with Addison disease are also at an increased risk of infections, as the immune system may be weakened due to the lack of cortisol. Conclusion. Addison disease is a rare but serious condition that can lead to significant complications if left untreated. The symptoms of this disease can be vague and nonspecific, which can make it difficult to diagnose. However, with proper diagnosis and treatment, most patients with Addison disease can lead normal, healthy lives.